Thank you for joining us today. We're here for a press
Recording
conference
in progress.
to give an update on COVID-19 in Waco and a status update to our community, as well as some community stories and testimonies of their experience to date. I want to start by introducing our Mayor Pro Tem, Hector Sabito, who has an announcement for our Spanish-speaking community and some other viewers at home.
Thank you, Mayor. Para que nuestra audiencia que habla español entienda completamente lo que se dice durante esta conferencia de prensa, me gustaría invitarle a participar en la conferencia de prensa más tarde el día de hoy. Actualmente se está produciendo una versión en español de esta conferencia de prensa y estará disponible para verla a las 4:30 de esta tarde. Puede ver la conferencia en español de prensa en el canal 10 de cable de la ciudad de Waco, a través de internet en wccc.tv y por Facebook también. Muchas gracias. Thank you, Mayor.
Thank you, Hector. Good morning. I call this press conference today because it is critical for everyone in our community to take a hard look at the current data regarding local and state hospital capacities and the significant impact that the dangerous Delta variant is having on our community. I want to be clear that the data and supporting information that will be shared today comes directly from our 2 local hospitals and our local public health district. This is real data from the real medical providers that you, members of this community, trust to take care of us, our children, and our loved ones every day. Like all of you, I desperately want COVID-19 to be in the rear view mirror. But the unfortunate reality is that we're in a standoff with this Delta variant. In fact, we are seeing some of the worst COVID numbers and subsequent outcomes we've seen since the beginning of the pandemic. As your mayor, it is my elected responsibility to stand before you and present you with data and facts, all of which indisputably illustrate just how close our local healthcare system is to the brink of collapse. And as such, I've personally heard healthcare leaders express more concern about the current situation than at other times, than at any other time in this pandemic. At the onset of the pandemic, the primary concern for all communities was hospital capacity and the risk associated with the potential system-wide overload of local and state healthcare systems. I want to be clear, we are on the brink. We are very close to doctors and nurses having to make unthinkable choices about who to care for and how long. And while the fact is that unvaccinated patients account for the overwhelming majority of current COVID-related hospitalizations, please hear me when I say this is not just about COVID. This is about making sure that we have the resources necessary to care for both COVID patients and those suffering from complications of a heart attack, serious car crash, or any other tragic event that warrants immediate medical attention. And candidly, we don't each do our part to change the trajectory of the highly contagious Delta variant in our community. If we don't each do our part to change the trajectory of this highly contagious Delta variant in our community, countless Wacoans will be faced with the real possibility of not receiving the level of care they undeniably require. LaShondra Mallory Horn, our health district director, will be sharing some important data points momentarily, but I want to emphasize a few points before she does. More ventilators in Waco have been used this week than at any other time during this pandemic. All 54 ICU beds at Baylor, Scott and White, Hillcrest, and Ascension Providence are in use. Right now, they are working to convert non-ICU beds to care for critical care patients. 92.4% of hospitalized COVID patients in Waco are unvaccinated. Our healthcare staff, nurses, medical techs, and physicians are exhausted and stretched thin. I myself was invited to tour the situation at one of the hospitals yesterday and saw firsthand how full this hospital is and how tired the hospital team is as well. On Sunday night, the Waco area surpassed our capacity for storing bodies of the community members we've lost. And we procured a refrigerated truck to add capacity. It immediately filled up, and we are currently housing 12 of the deceased. We will continue to monitor the situation. We were able to procure a second truck and have capacity. At the request of the local hospitals, our Office of Emergency Management has and continues to request state assistance for increased hospital staffing. I urge anyone who has not received a COVID-19 vaccine to talk to their doctor or healthcare provider and make a plan to get vaccinated. If you're concerned about this vaccine, I implore you to consult with your doctor, just like you would other health-related matters, to thoroughly discuss these concerns. There is broad consensus from local and state hospital leaders, health district leaders, and countless local physicians that vaccines are safe and the most effective way to ensure we are able to care for those who require immediate medical attention, COVID or otherwise. If you choose not to get a vaccine, I ask you to respect how contagious this virus is, causing patients of all ages to develop serious illness requiring hospitalization. Please alter your behaviors by doing things like wearing masks and distancing so we can reduce hospitalizations and ease the burden on our medical professionals and community members. I know this is not popular with many people, but please know our hospitals need this. In fact, Governor Abbott himself is vaccinated, and per his video message last Saturday, said it is more likely because of his vaccine that his experience with COVID was both brief and mild. Are breakthrough cases popping up? Yes, of course. But those breakthrough cases are to be expected and more often than not tend to range from asymptomatic to mild symptoms, either of which rarely require a visit to the hospital. Wacoans are resilient, and time again, we have come together as a community. As your mayor, I'm asking for your help now to make sure our hospitals don't reach max capacity. We are at this brink, and I say this not to scare you, but to inform you. As your mayor, I'm asking for your help to make sure our hospitals don't reach this max capacity. We are close to reaching this point, and that's a fact. This is not about politics. This is not about scare tactics. This is about sharing through the very real possibility that we might have to make hard decisions on who we provide care to. Waco is a good city because of its good people. So in this moment, I urge Wacoans to continue to speak kindly to one another and to work together in these divided, difficult, and challenging times. Like we've done together in the past, we have to continue to choose the high, decent road. Give grace, be kind. This is the Waco way. To the frontline workers, the nurses, the doctors, hospital staff, teachers, school workers, our health district staff, our city staff, thank you. I know this is a hard time. I know you're tired. Don't lose heart. We see you. We are grateful. To the leaders in our community, our pastors, our school principals, our superintendents, hospital leaders, CEOs and business owners, nonprofit directors, and anyone leading an organization. Hold on. Your leadership matters in this moment. Be strong and courageous. I can promise you the City of Waco and the Waco-McLennan County Public Health District are committed to ensuring our community has access to timely, accurate information and data, free vaccinations, and free testing. You'll hear more of this momentarily, and I encourage you to visit covidwaco.com for the most up-to-date information. We will continue to make improvements, and you'll see a refreshed look at our dashboard and communications. And with that, I'm going to turn it over to some compelling community voices. I want to start with Ms. Ray Jefferson, who has joined us today to tell us some of her story. So with that, I'll turn it over to you, Ray.
Good morning. Thank you for having me. So the decision to get vaccinated was made for me before the pandemic even began. About 3 years ago, my mom was diagnosed with kidney disease, and at the time of her diagnosis, her kidneys were functioning at about 15%, which is far below the levels that are needed to keep you alive and keep your blood and your body clean. So she and my dad immediately started to do all the things that you're supposed to do whenever you have kidney failure. They started a really strict diet of kidney-friendly foods. They went to a team of doctors who helped them figure out how to get her on the kidney transplant list. They started the really exhausting process of almost daily dialysis treatments, where a machine helps to keep her blood clean and helps to keep her alive. That treatment lasts for about 16 hours every week, so it's really grueling and really time-consuming. But we thought that we'd be able to get her on the transplant list pretty quickly. We're scheduled for surgery and back on her feet in no time, but it quickly became clear that there were more obstacles than we'd anticipated to this process. In order to have surgery, a doctor has to prove you for your heart being strong enough to make it through the procedure. And unfortunately for my mom, after 1.5 years of dialysis and even more weakening of her kidneys, her heart wasn't going to be strong enough to make it through. And so her doctors went back to the drawing board. They put her on a plan to help build up her heart function. And things were going really well. And it looked like we were going to be able to get her scheduled for a transplant. And then COVID happened. And so in 2020, right after she was cleared for surgery, hospitals stopped doing elective surgeries, which included transplants. And as you might imagine, our family was really devastated, her more than anyone else. So not only would she have to continue to do dialysis, which her entire life has come to revolve around, she's also an immunocompromised person in the middle of a global pandemic. And so she's really vulnerable to illness, and the rest of our family has been terrified of bringing COVID home because we know that that could have really deadly consequences for her. So for a year during the pandemic, I stayed away from all of my extended family and friends, people who I love very much and wanted to spend time with, because I knew that COVID would probably end really badly for my mom. And so when the CDC finally started to talk about a COVID vaccine, for me, it was never a matter of if, but rather when I would get it. And so I signed up for the vaccine the first chance that I got, because it brought me a peace of mind that I hadn't had for almost 12 months. I spent all of that time inside of my house, just kind of in constant fear of what an outing might mean for my mom. And although I know that the vaccine does more to protect me than it does to protect those around me, I made the decision to get it because of my mom. I've seen firsthand what it's like to lose your health. And although my mom hasn't been suffering from COVID, for about 3 years, I've witnessed the physical and emotional pain of losing the functions of your body and losing your health. And it's been enough to keep me from taking my health for granted. So COVID vaccines do what they're supposed to do, which is to keep you as healthy as possible, even if you do happen to catch the virus. And getting it was really the best and easiest decision I could have possibly made for my health.
Thank you, Ray. We so appreciate you jumping on with us today to share your story. The stories of Ray and the others that we'll be sharing will be split out, and we'll share those on social media so other people in our community can hear from our own community members, not just a government official, about their own story. So with that, I'm going to turn it over to David Littlewood, who is a leader and friend in this community, and give him an opportunity to share his story to our community as well. So with that, I'll turn it over to David. Thanks for being with us today.
Sure. Thank you, Dylan. I appreciate you so much, and all the folks that you mentioned earlier. My daughter is a nurse at one of the local hospitals, and typically she works in surgery. That's her routine, and all surgeries right now have been shut down. So it's all hands on deck pretty much for COVID-related cases. And it's a very stressful time. So thanks for recognizing all of those folks. I hear it firsthand often from her. My experience was very unexpected. At the time, 59 years old, very healthy, had never really been sick in my life, very fortunate, never been hospitalized, had never had any surgeries or anything like that. I think probably in my lifetime twice, maybe I've had the flu. That was probably the worst illness I'd ever had, out for a day or two, 3, and then back to normal. So I was not fearful at all of COVID, although I respected all the aspects of risk, and certainly was fearful for others that I felt like were higher risk than myself. So in December, I did contract COVID. Initially, I had a little bit of fever. I ached. I lost my taste. I still really didn't believe that I had it, but I went and got tested, and sure enough, it was positive. And so they, followed instructions, stayed home, quarantined, the whole 9 yards, thinking that I would have a mild case because I was in good health. And I did have what I would have considered a mild case for about the first week, 7 to 9 days. And then my case turned very, very dark and very drastic, and I declined. And so from that point forward, for about 10 days, I ran fever 24/7, about 102 to 105, which is a lot of fever for anybody. For an adult, to somewhat senior adult, that is a whole lot of fever. Nothing would really control it. My breathing was very, very challenged. My oxygen rate was in the 78 to 85 range most of the time. And most interestingly for me, for that 10-day period, my heart rate was, my normal 24-hour-a-day heart rate was 140 to 200. And so that was my existence for about 10 days. And about 4 of those days, I really thought I was not going to make it. My wife wanted me hospitalized. I have a very good friend who's my internal medicine physician, and he was adamant that I not treat this in the hospital. He said, we need to treat you at home. I'm going to treat you with all the same things you would have at the hospital, but I'm concerned of the isolation. And I think with your case, you may end up being intubated if you go to the hospital, and that will not end well for you. So I followed his advice, and I emerged from COVID and felt like I was on the other side or headed there, but had post-COVID, I had fatigue that was just beyond belief, and got to the point where I and my doc also believed that, this is not just recovering from COVID, you've got something going on. So we had a lot of tests run, and it turns out that COVID actually in some way changed the composition, changed some dynamics as it relates to my heart. And I ended up with a pretty bad case of AFib, which is an irregular heartbeat that causes your heart unexpectedly and randomly to race, and because it ends up having electrical impulses that misguide your heart to have extra beats. Long story short is you treat that with meds, or you have a procedure called an ablation that often works to help. But bottom line is I emerged from COVID with a heart problem that needs to either be treated with meds or treated with surgery, and hopefully we can get beyond that. But there's implications long-term with what developed as a result of my having COVID. And not to say that I'm a very adamant person about freedoms of our country, the freedoms that are given to us and that we can't take for granted. I am not in favor of mandates. I'm not a person who believes that we should mandate by law that people are vaccinated. But I believe that when you look at the data, as you alluded to, and when you look at the situation of vulnerable folks, as the prior speaker with her mother, I just think that we owe it to the world. We owe it to the people around us, the people we love, the people we don't know who are vulnerable. The vaccine is proven, it works. The breakthrough cases, typically, if there are breakthrough cases, are very minimal compared to a full-blown COVID case on a non-vaccinated person. And I'm not a doctor, but I do read, and I just believe that in this situation, it's in your best interest and everyone's best interest to just bite the bullet, get the vaccine, and go on about your life. And I think that's the way we return to normalcy. And so I would ask anyone who's on the fence to reconsider. I was fortunate enough to get the vaccine in March, and I will get a booster. And, my biggest concern is having COVID again and what might happen in that situation. So personally, I was very much a believer that the vulnerable needed to be vaccinated, and that was kind of what my thought would be. And I didn't consider myself to be vulnerable, but I was proven very wrong. And so the other piece is just don't take it for granted that COVID's not going to do some really bad things to you. It's indiscriminate. It's completely indiscriminate, and it can happen to you. It can happen to a loved one, and don't let that be the case.
David, thank you so much for joining us today and sharing your story.
Thanks for having me.
Appreciate it. Next, I'm going to go to another friend and another community leader, Fernando Arroyo, who has been incredibly involved in our city for years and does a lot of great work here. So with that, I'll turn it over to you, Fernando.
Thank you, Mayor. Thank you for the chance to join you all. I grew up in South Waco. My community, my family, my neighbors mean everything to me. And COVID has impacted every single part of my life. At work, we help people get well and stay well and not get sick. My kids are in school, and I get concerned for their safety and the safety of our school leaders, our teachers, our staff. My loved ones include friends who are aging and have multiple health concerns, babies with vulnerable immune systems, and lots of kids who can't yet get vaccinated. Early on in the pandemic, an uncle and a close friend and a coworker of mine died from COVID, something I would never want on anyone else. but unfortunately many of us are experiencing, please, please, please get the COVID vaccine. It's the most effective way to combat the virus. I got my vaccine because it'll keep me from getting seriously sick or dying, and to protect my community from greater spread and from new mutations. No corners were cut on the safety of the vaccine. The side effects are temporary. COVID has especially hit the Latino community hard for many reasons. If you've already had COVID, the vaccine will give you extra protection. You'll be helping your own community. And like me, you're probably ready for a brighter day, for fiestas, for feasts, for fun, without our friends and loved ones getting sick afterwards. Make a plan today and make an appointment today and encourage someone else to get the vaccine. Getting the vaccine gets you and me a little bit closer to the kind of community we know and love, to share a meal with vulnerable friends, and to hold and snuggle with our babies. Thank you very much, Mayor.
Hey, Fernando, we appreciate you for all you do. Last on our community member panel, we have Dr. Clint McHenry. He is the president of the McLennan County Medical Society. And as I mentioned, I'm so thankful for our doctors who have been frontline workers, and he's here today to share with us. So with that, I turn it over to you with much appreciation, Dr. McHenry.
Thank you, Mayor. As mentioned, my name is Clint McHenry. I'm a local family medicine physician and the current president of the McLennan County Medical Society. So I'm going to read a letter that thus far has been signed by 294 local physicians here in the Waco area. This letter will be published in the Waco Trib on Sunday so that you'll be able to read it. And without much commentary, I'll just read it and kind of let the letter speak for itself. Fellow community members, we are local physicians who live and work here in our community. Many of you know our names or know us personally, as we may have taken care of you or your loved ones over the years. You see us at church, the grocery store, and at social and sporting events. Our children go to school together. We care deeply about our community. We are all extremely different human beings who vary in our backgrounds, experiences, and political opinions. We root against each other's sports teams. We vote for different candidates and different political parties. One thing we have in common, however, is frustration and despair about our current COVID-19 vaccination situation. Some of us were among the first people in the area to become infected with COVID-19, and most of us were the first to roll up our sleeves and get vaccinated. We have spent the last 18 months taking care of people in our community, at times risking our lives and personal health, and risking carrying infection home to our own families. We have seen firsthand how this virus has taken many, many lives. We have watched it destabilize our local and global economies. We have watched it disrupt lives, education, and our way of life. For several months following the rollout of the vaccine, we saw a decrease in the number of COVID-19 cases, hospitalizations, and death. However, within the last month, we have once again seen a remarkable increase in these numbers. We are experiencing the dreadful feeling, here we go again. The COVID-19 vaccines are a modern medical miracle. Fundamentally, the vaccines were developed leveraging previously established scientific methods and technology. The support for the vaccines was brought about by the Trump administration. After the presidential election, the Biden administration continued the massive rollout and financial support. Both of these efforts have made vaccine availability to Americans among the greatest in the world. Similar to the efforts that won World War II and put human footprints on the moon, it is something to be proud of as an American. What is not to be proud of, however, is that we are currently suffering from massive disinformation. It is heartbreaking to see lies and deception from all sides of the political spectrum costing people their lives. The vaccines currently available have been administered to billions of people around the globe. There are no vaccines of any kind that are 100% safe nor 100% effective, but real statistics show that the risks of these vaccines are extremely small and the effectiveness is very high. Consider the history of other diseases halted by vaccines. The precedent has been set, and the answer to this tragedy is within our grasp if only we choose to use it. Further waves of infection are entirely preventable. Current statistics show that the large majority of Americans dying of COVID-19 are unvaccinated. We see and are impacted by this in our own hospitals today. Ignorance and disinformation are quite literally killing our friends and neighbors. We strenuously urge you to please listen to us, your physicians, regardless of your political affiliation and your trust or distrust of government and politicians. We spend our days and our careers taking care of our community. Please, please sign up and get fully vaccinated against COVID-19. Even if you don't feel that you are personally at high risk, unvaccinated individuals will almost certainly eventually develop COVID-19 infection. When you become infected, you will spread the virus to others, most likely before you even realize you have it. For your family, neighbors, and community, please do the responsible thing to prevent the sickness and death we are seeing all around us. While we are honored to be considered healthcare heroes, we would much prefer to simply see all of our community members protect each other by following our advice to get vaccinated. Thank you.
Thank you, Dr. McHenry. I think it's compelling that nearly 300 local doctors signed a letter urging vaccinations and bringing attention to this matter. We turn to doctors for our healthcare needs, and that is something we've always done. So I think that it's certainly something that we should weigh heavily when we hear these trusted leaders who have given their lives to the study of medicine are endorsing this. We appreciate your time. To our community member panel, thank you so much for joining us today. You're welcome to stay on for the remainder of this press conference, but I know you're busy, so you're also free to jump off now. And again, can't thank each of you, the four of you, enough for taking time from your busy schedules to be with us. With this, thank you guys. With this, I will turn it over to our Public Health District Director, LaShonda Mallory Horn, and after that, we will hear from our two hospital systems, and then we'll wrap up. So with that, I'll turn it over to you, LaShonda.
Thank you, Mayor Meek. And thanks to the community members that shared their very compelling stories. And I hope the message was reached by all. The dedicated and professional public health team at the Waco McLennan County Public Health District has been actively monitoring the spread of COVID-19 in the community. Since April, there has been a drastic increase in the number of COVID-19 cases reported daily. With an increase in cases, there's also been an increase in the number of hospitalizations and unfortunately an increase in deaths. As of yesterday, August 24th, there were 1,197 active cases of COVID-19 in the county. According to the Heart of Texas Regional Advisory Council, the McLennan County Hospital hospitalizations are at 164. Of those, 7.65% of those have been vaccinated, leaving 92.35% of those unvaccinated. This speaks to the message that we've already heard, that vaccinations work. Our ICUs are full. 54 beds are in use, and 45 of those are in use for COVID-19 patients. The mayor stated how concerning this is for us, not just around COVID-19, but in the event that there is any other emergency or needs for ICU hospital beds, our hospitals are really at a point where they're having to make hard decisions. Ventilators are in use at a higher rate than ever. As of today, we have 36 patients that are on vents, and 2.35% of those have been vaccinated. Again, 97% of those have not been vaccinated, and it goes to speak to the reality that vaccinations work. The only way for our county to get ahead of the spread of COVID-19 is to increase the number of people in our community that's vaccinated. In May, our team began offering vaccine clinics across the county in areas where people can easily access vaccines. And this has been an opportunity for us to get back out into the community doing public health work. A total of 76 vaccination clinics have taken place since May, and we've administered 1,896 doses. 40 clinics have been hosted just in the month of August, with a total of 984 doses administered. We have 15 contracted staff that are able to turn around a vaccination clinic between 24 and 36 hours. We have 7 clinics that we've hosted with Waco ISD, with 5 more scheduled, and we've given 440 doses of vaccine. And at the La Vega ISD, we've had 4 clinics and we've given 74 doses of vaccine, and we're scheduled to have a clinic every Monday at La Vega High School through the end of September. In addition, we're working with Atstall ISD, Lorena ISD, Golson, China Springs, Connolly, McGregor, Valley Mills, Mart, and the Harmony Science Academy to schedule vaccine clinics. We are willing to take the vaccine to the students, staff, and parents of all of our school districts. Teachers and students have been targeted in clinics at the Education Service Centers and the Methodist Children's Home. The Health District provides vaccine here on our campus from Monday through Friday from 8 a.m. to 4:30 p.m. To date, since May, we've given 1,113 doses of vaccine in the Health District. We are now able to give the 3rd dose of vaccine to those that are immunocompromised. All you have to do is walk in or schedule an appointment at covidwaco.com. In the coming weeks, we will be releasing information regarding booster vaccines for those who receive vaccines through the Health District in December through March. We're offering testing Monday through Wednesday from 9 to 6 at the Waco ISD Stadium parking lot, and Thursday through Friday from 9 to 6, and Saturday 9 to 1 at the McLennan County Community College Community Service Building, parking lot M. These tests are free of charge to community members. Appointments are required, and we are monitoring appointment availability. Visit covidwaco.com to schedule an appointment. There's also a list of additional testing options available at covidwaco.com, and some pharmacies are selling at-home rapid test kits. Together, we can stop the spread of COVID-19 in a few easy steps. To start, the Health District encourages everyone to wear a mask when in public places, regardless of vaccination status. If you feel sick or have been exposed to COVID-19, get tested and stay home until you know your test results. And lastly, get vaccinated. Daily updates regarding COVID-19 are available on the Waco and McLennan County Public Health District social media pages, including Facebook, Instagram, and Twitter, as well as covidwaco.com. Thank you, Mayor.
Thank you, LaShonda. We appreciate all your work. You're definitely on the front lines and have put in long hours and hard work this week and many others. So thank you for what you do for our community. We're going to now turn over to our hospital leadership. I'm going to start with Dr. Brian Becker from Ascension Providence to give an update, and then we'll go to Dr. Ahmad from Baylor Scott and White Hillcrest. So, Dr. Becker.
Thank you, Mayor Meek, and thank you for the frank opening comments. You were accurate and spot on with the things that you shared in those opening statements, so thank you very much. I'd also like to thank the Waco McLennan County Public Health District, as well as our city and county leadership for continuing to provide a comprehensive and coordinated approach to trying to manage through this pandemic. Ascension Providence is working closely with the Public Health Department as well as local healthcare entities to respond to our community needs. We're at a critical point in the fight against COVID-19. This deadly virus has already taken the lives of more than 52,000 Texans. The vast majority of patients, as has been spoken to previously in this press conference, more than 90% are unvaccinated in our hospital. So current hospitalizations, the vast majority unvaccinated. We are urging the community to get vaccinated to not only protect themselves, but to take the burden off of our frontline workers who've been fighting this virus for the last year and a half. Earlier this week, the FDA, Food and Drug Administration, gave full approval to the Pfizer COVID vaccine. It's the first COVID-19 vaccine to go from emergency use authorization to full FDA approval. It's an important milestone. While all of the vaccines available in the U.S. have long been considered safe and highly effective, now that this FDA full approval has been granted to Pfizer, we anticipate that many more people in our community will step up and be vaccinated, helping us to overcome the COVID-19 pandemic together. Additionally, as LaShonda just spoke to, the Centers for Disease Control and Prevention have recommended people that are moderately to severely immunocompromised receive a third dose. And I'm hopeful that in the very near future, we'll get some further instruction on the rest of the population getting booster vaccines as well. Currently, our facilities have sufficient capacity and staff to continue to care for patients with a variety of medical needs. Our nurses and physicians are exhausted as our hospital faces critical shortage of nurses and other support staff. I had a couple of questions I was asked to speak to preceding the start of this. And it really goes to that latter point. So how are our frontline staff holding up? How are our physicians holding up? And then are we experiencing any significant shortages in staff? We have seen a significant increase in the number of COVID patients that are requiring hospitalization and intensive care. And certainly the Delta variant is the most contagious strain that we've seen yet. This latest spike in COVID hospitalizations is putting extraordinary pressure on our hospitals, emergency departments, intensive care units, and in general, across all the healthcare profession. The rising number is discouraging. Our responsibility during the pandemic continues to be balancing our readiness to care for patients with COVID-19 while making sure that we maintain a capacity to deliver care that's needed urgently and emergently. We don't want to see what we saw the first time around in this, where people delay care. There are a number of opportunities now to receive care. Most healthcare organizations have perfected telemedicine, and the ability to access your physician for chronic conditions without having to go to an office is certainly an option for folks. Our emergency rooms have been extremely busy. We have maintained some hospitalized patients in our emergency room as we've had a lack of sites to move them to in the building. So as we see an increased number of patients in the emergency room, as we are holding patients who require admission in our in our hospital, those wait times can get extremely long in our emergency room. There are other alternatives, express cares, freestanding emergency rooms. Those are options for patients to consider as well. Certainly our emergency room is open and will be open for walk-in traffic. We will continue to take care of the needs of the community as necessary, but I do urge you to consider other options for care as well. Our nursing and our physician staffing, if we look at where we started this a year and a half ago, we certainly are experiencing some shortages in our nurse staffing. As Mayor Meek alluded to earlier, we have submitted requests for state assistance for nursing as well as respiratory therapy. And I'm happy to report that that has been approved, and we have begun to see some of those individuals arrive at our facility over the last week and a half, which has increased our capacity to care for patients. Our physician morale, the morale of the folks in the building remains high, despite the increased burden that they are carrying. So I think in summary, we are receiving assistance for staffing. We continue to bring in traveler nurses when we can get them here. And our physician and medical staff continue to be strong and provide great care in the facility.
Thank you, Dr. Becker. And with that, we'll turn it over to Dr. Ahmad from Baylor Scott and White Hillcrest.
Thank you, Mayor Mead. My message is consistent with all of the guests we had, and Mayor, with you, with our health department and our colleagues across town. Please get vaccinated. We endorse vaccination as an health industry and entity of Baylor Scott and White. I also want to start by thanking the frontline staff members, our EMS, our ER, our ICU nursing staff, physicians, our hospitalists. They are showing signs of burnout, but they are holding good, just like Dr. Becker mentioned. They are working, they are still optimistic that this community is going to rise above and beyond by getting vaccinated and help us reduce the burden in the coming weeks that we are seeing. 40% of our beds are occupied by COVID patients, acute care beds. That's a lot of care to one disease. Because of that, we certainly are seeing that critical care needs are higher, as you guys alluded. And this time go around, the patients are younger, they are sicker, and we are also seeing pregnant patients, and we are also seeing children getting involved with Delta and getting sicker. And that McLean Children's Hospital is helping us, being our partner in helping our children population. We strongly recommend social distancing, masking, and ultimately vaccination. Vaccination is our golden ticket to get out of this pandemic. Our capacities are above 100% most of the places, but we are trying to be creative in finding ways how we can identify the sickest patients who need the help, and we can defer the care of the patients who are elective that we can postpone for 2 to 3 weeks. One of the questions was asked is, with COVID, how much deferral are we doing in the care? And I would argue what Dr. Becker said and Mayor Meek, you mentioned, we are deferring the care with anywhere we can, which is not emergent, because the beds are occupied, the team is burned out, and we need those beds for the sicker patients. And anytime a sick patient is coming who needs emergent care, doors will remain open. We will provide the care, and we are fully staffed to support that emergencies. Last but not the least, one of the questions was, how are we handling the ICU bed shortage? We are building a nursing team approach, where we are combining our experienced nurses with our less experienced nurses. We are utilizing the help of our telemedicine portal, and we are also requiring canceling the elective surgeries and helping getting the help from our anesthesiology team members to help those critical care patients. So that's how we are managing, and we believe with vaccination in the coming weeks, we will be able to get through this. And we are still holding high, and we are optimistic we'll get through this. Thank you, Mayor.
Thank you, Doctor. That is the conclusion of our press conference. I want to thank our participants, our community members who took away time from their busy schedule to join us today and participate to tell their stories. My hope is that Wacoans and residents of McLennan County will hear the message from their neighbors and that will stick with them. I want to thank LaShonda and the whole public health district team. She's got a great staff over there. Stephanie Alvey, Kelly Crane, and the entire health district team. Thank you for your hard work. I want to thank Dr. Becker and Dr. Ahmad, as well as their leadership. Charles Williams at Baylor Scott & White and Philip Patterson at Ascension Providence. We have great hospital leadership in this community who are working really hard to make sure that our community is getting that access to care that they still need right now. Thank you to our friends over at McLennan County who continue to be great partners with us here at the city. We appreciate Judge Felton and that team as well. And I've continued to be in discussions with Judge Felton and that organization, so thankful for them. I want to do one last reminder. A virtual town hall will take place tonight at 6 p.m. In Spanish to talk on the safety of the COVID-19 vaccination. Mayor Pro Tem Hector Sabito will be hosting that. It will be available on all City of Waco social media platforms, our cable channel, and I believe on Channel 10 as well. And more information about that is available online. Thank you to everyone who joined us today. We will continue to update you with accurate information in the days ahead. Have a good day. Thanks.
we have involved